Part 2, can a physical therapist teach physician MSK ultrasound? The evidence nobody talks about. In part 1, we talked about training, reps, residency education, and why teaching is its own skill. In part 2, I want to zoom out and look at something bigger. The evidence behind why PTs are not only capable of teaching MSK ultrasound, but we're uniquely positioned to do it. And not just do it, but do it well. Okay? None of this is opinion. This is data. This is history. This is the actual trajectory of MSK care. So let's start with diagnostic accuracy. There's a study that rarely gets mentioned in these conversations. Or if you're in certain circles, you might hear them more often than others. But I want to bring it front and center. So research has shown that physical therapists can outperform non-orthopedic physicians in diagnostic accuracy and perform equally to orthopedic surgeons. Okay, so that was in the PT Journal in 2005 or 2007 that came out. Not almost, but not close, just equal, right? Why? Because our movement is our domain. Tissue behavior is our domain. Biomechanics, loading, provocative testing, that's our daily language. Ultrasound is simply an extension of that skill set. It's not new. In the 1970s, since the 1970s, the military has run one of the most important and most overlooked models in MSK primary care. PTs have served as physician extenders, ordering imaging, managing MSK cases, and functioning as the first line of evaluation for service members. So the results of this have been massive. Faster access, higher diagnostic accuracy, lower costs, no increase in adverse outcomes, and no litigation against the United States government. This has been proven for decades. PTs are system-level stewards of primary care at MSK. We've been doing this work long before ultrasound was portable, affordable, or certainly mainstream. So when people ask, can a PT teach physicians ultrasound, they're asking the wrong question. The real question is, who is trained, experienced, and positioned to teach MSK ultrasound at a higher level? So when you look at this, okay, the diagnostic research, the military's MSK model, the movement-based foundation of PT education, residency and fellowship training in orthopedics, RMSK level competency, and over a decade of daily scanning and procedural collaboration, the answer becomes pretty clear. It's not about hierarchy. It's not about titles. It's not about turf. It's about competency, clarity, and clinical outcomes. Ultrasound is not a profession-owned skill. It's a competency-owned skill. Okay, I'll say it again. It's a competency-owned skill. And the clinicians who master it, regardless of degree, are the ones who should be teaching it. So our learners in our program at AMSK were overwhelmingly physicians. MDs, DOs, sports medicine fellows, pain specialists, orthopedists, PAs, MPs, and naturopathic physicians. They don't come to us because a PT teaching ultrasound is controversial. They come to us because the teaching works, because the system works, and the results are credible and immediate. Okay, we make ultrasound make sense fast, clearly, and in a way that elevates clinical practice, starting on day one. So part 2 of this conversation ends with this. PTs, we're not just capable, okay, we're not just able, we're historically validated, research supported, and clinically positioned to do it exceptionally well. Not because of the letters after our last name, but because of the competency behind them. That's the reality, not the assumption.